My name is Malcolm Brownell, and I'm a postdoc research associate in the Ready Lab at Texas Tech University Health Sciences Center in Lubbock, Texas. Today's webinar is about dementia, its forms, causes, diagnosis, treatment, and prevention. I've studied the behaviors of dementia for over 10 years, and my current work is studying the impact of lifestyle and other factors on the cognitively superior elderly population of West Texas. I am dedicated to improving the quality of life of the elderly. What is dementia? Dementia is a term used to describe a group of symptoms affecting memory, thinking, and social abilities. In people who have dementia, the symptoms interfere with their daily lives. Dementia isn't one specific disease. Several diseases cause dementia. Dementia generally involves memory loss. It often is one of the early symptoms of the condition. But having memory loss alone doesn't mean you have dementia. Memory loss can have different causes. Alzheimer's disease. This is what you think of when you hear dementia. It's the most common type. Around the world, as many as 70% of people with dementia have Alzheimer's. In the US alone, about 6.5 million Americans who are 65 or older have been diagnosed. Experts don't yet fully understand what causes Alzheimer's. It's probably due to a mix of natural aging, your genes, things in your environment, and things about your lifestyle, like what you eat and how much you sleep. The brain changes that Alzheimer causes can actually be seen in brain imaging scans. Experts describe them as plaques and tangles. If you or someone you know has Alzheimer's, you could notice symptoms like memory loss and trouble planning and doing everyday tasks. There might be mild at first, but get more severe over time. Typical Alzheimer's signs include repeating yourself, getting turned around or lost in familiar places, forgetting past conversations or scheduled events, struggling to find the right words, finding it hard to do more than one thing at once or follow multiple steps, and making poor judgments or reacting slowly. The second most common type of dementia happens when blood flow to your brain gets blocked. That can happen for a number of reasons, including heart disease, a stroke, a blood clot, or because of major surgery. You're at higher risk of vascular dementia if you live with high blood pressure, high cholesterol, or diabetes. The symptoms you have will depend on which part of your brain has decreased blood flow. While Alzheimer's usually begins with memory problems, vascular dementia can start with trouble planning, organizing, and making decisions. The signs of vascular dementia can also include stroke-like symptoms like finding it hard to speak, getting easily confused or upset, especially at night, changes in your usual personality and mood, a change in how you walk, for instance, shuffling instead of picking up your feet, poor balance, urgency when you need to pee. Lewy bodies are tiny deposits of a protein that collect in your brain and prevent important cells there from talking with each other. They're named after the scientists who discovered them. Researchers are still trying to better understand why these proteins start clumping together, but they know that they sometimes show up in other types of dementia too. DLB symptoms include struggling to think clearly, make decisions, or pay attention. Seeing things that aren't there, known as visual hallucinations. Hearing or smelling things that aren't there, that's non-visual hallucinations. Having a hard time with language or numbers. Losing track of time or where you are. Physically acting out dreams, such as talking, walking, and kicking. Movement issues like tremors or moving more slowly than usual. About 50% of people who live with Parkinson's disease, a nervous system disorder, notice at least a slight change in their memory and their ability to think. Over time, this can worsen and make getting through your daily life more challenging. Some signs of PDD include short or long-term memory issues, a hard time getting around places, especially if they're busy or crowded, mood changes, Delusions like strange beliefs or feeling like people are out to get you, struggling to recall the names of everyday things. PDD is very similar to DLB. You can have a lot of the same symptoms, and researchers have found that Lewy bodies are often present in people with Parkinson's dementia. The phase Lewy bodies dementia is sometimes used to refer to both DLB and Parkinson's disease dementia. As many as 1 in 10 people have more than one type of dementia. If so, you have what's called mixed dementia. The two most common combinations are Alzheimer's and vascular dementia, and Alzheimer's and DLB. Mixed dementia doesn't have its own unique symptoms. How your memory and thinking are affected will depend on the different types of dementia that you have. Having two sets of symptoms can make your overall condition more of a challenge to diagnose and treat. Your doctor may suggest several therapies as well as medication to manage your symptoms. If you or a loved one has frontal temporal dementia, a doctor has found cell damage in areas of the brain that control planning, judgment, emotions, speech, and movement. Someone with FTD may have personality and behavior changes, a sudden lack of inhibitions in personal and social situations, challenges when trying to come up with the right words when speaking, movement issues like shakiness, unsteady balance, and muscle spasms. Other dementias include early onset dementia, Huntington's disease. This is a brain disorder that's passed down through family members. While you or your loved one might have the gene for Huntington's disease at birth, symptoms don't usually show up until ages 30 to 50. Crutchfield-Jakob disease. This is a rare condition in which proteins called prions cause normal proteins in your brain to start folding into abnormal shapes. The damage leads to dementia symptoms that start suddenly and quickly get more severe. NPH. CSF is a special fluid inside your body that sends nutrients to your brain cells and helps flush out waste. If it stops circulating the way it should and gets backed up, it can cause this type of dementia. NPH symptoms often start slowly, then worsen over a few months. WKS, a rare condition. WKS can happen when you don't get enough thiamine, vitamin B1. This vitamin is key to turning sugar into energy that your body can use. Without a proper amount, your brain cells get damaged. Alcohol-related dementia. Regularly drinking alcohol for many years can shrink parts of your brain and cause a form of dementia. Unlike some other types, alcohol-related dementia may not get more severe over time. Treatment can make a big difference. CTE dementia. Repeated head injuries like concussions can damage your brain over time. You're at a high risk of CTE dementia if you play a contact sport like football, where you might take frequent blows to your head. It's also seen in military veterans and survivors of violence. Diagnosis. One or more of these tests may be recommended by your medical provider. Diagnosis aims at finding at least two impaired mental functions that interfere with daily activities. Doctors may order several tests to confirm the diagnosis. Common tests and procedures include patient history or family history or any other injuries to the head are determined. Laboratory examination include blood and spinal fluid examinations to check for infections, nutritional deficiencies, and hormonal imbalance. Psychological examination to determine mental health conditions causing dementia. Cognitive and neuropsychological tests to evaluate thinking, memory, reasoning, judgment, language, and attention abilities. Neurological tests to check for visual perception, movement, problem solving senses, balance, and reflexes. CT scan of the brain is done to check bleeding or tumor in the brain. An MRI of the brain provides a detailed image of abnormalities of the brain, and a PET scan is done to check for brain activities. One or more of these treatment options may be suggested by your provider. Most types of dementia cannot be cured. Treatments aim at reducing symptoms and progression of the condition. Some medications help to improve memory and cognitive functions, while others are to improve learning and memory. And then you have antipsychotics to treat symptoms of anxiety, depression, and agitation. Self care is important. Always talk to your provider before starting anything. The environment by reducing noise and distraction to help dementia patients focus and work. Modifying tasks by breaking them down into simpler tasks to help patients retain focus. Foods to eat include fruits, vegetables, and whole grains in your diet. Include vitamin E supplements. Include fish in the diet to obtain adequate amounts of omega-3 fatty acids. Include low fat and fat free foods to manage high blood cholesterol. Use salt and sodium moderately. Foods to avoid: always avoid carbohydrate rich foods to manage diabetes. There are specialists that you can consult with. They include occupational therapists. Occupational therapy is to make your home environment safe and help you cope with your condition. You see a neurologist, specializes in treating diseases of the nervous system, which includes the brain, the spinal cord, and the nerves. You see a psychiatrist, specializes in the branch of medicine concerned with the diagnosis and treatment of mental illness. Dementia prevention. While forgetfulness and problems thinking most often show up in people ages 60 or older, medical research is discovering that the disease starts making changes in the brain many years before that. Healthy choices and lifestyle changes in your 40s may make a difference in your dementia risk. 5 steps you can take now to help is to control your high blood pressure, address diabetes. If you smoke, quit, achieve and maintain a healthy weight and BMI, and get more physical activity. It's never too soon to address vascular health and potentially prevent dementia. So, to conclude, there are many types of dementias that affect different parts of the brain. The most common dementia is Alzheimer's disease. An early symptom of dementia is usually forgetfulness, but there are other causes of forgetfulness. Different exams test for different types of dementia. There is currently no cure for dementia, but there are treatments which include medications, occupational therapy, and psychological therapy. And again, healthy lifestyles that start in your 40s can reduce your risk of dementia. If you have any questions or would just like to talk, you can contact me at malcolm.brownell@ttuhsc.edu, or you can call me at 806 743 3751. Thank you.